Welcome back to Bridging the Gap. We are here again with Robin, our under 65 individual and family sales manager here at Nelson and Associates. And the last two sessions have been extremely informative, and I certainly hope that you are gaining knowledge and you feel a little more comfortable with the process of getting health insurance. In today's session, what I would like to talk about, Robin, so I come in, I call the office, I make an appointment with you, I come in. What are some things that I need to bring with me? I mean, I know that when you put those four pieces of information in the system that you use, it's probably going to produce thousands of plans that are available to me.
Right.
And where do we start? Like, how do we start cutting back and figuring out what one plan I need, in opposed to me trying to decipher the difference between an HMO or a PPO or all of these plans that popped up, and you don't just hand them to me and say, here, pick one.
Right, right. So it can be overwhelming. And if anybody is like me, I'm a little ADD. And if you give me more than three choices, I get really overwhelmed. And I'm like, that's it. I'm done. I'm not even going to do it. So
Yes.
it could be very frustrating for a consumer to go in there and have all those plans to look at. So what you can expect from us, first of all, you can walk in the office. We take walk-ins. It would be best to make the appointment, but if you don't worry about that at all. Just come on in. Appointments, it just allots us plenty of time to go through your policy, through the policies, I should say, and kind of educate you. Like I said, we really want to educate you on what you are fixing to purchase, because it's a pretty big deal. So what we'll do is we'll sit down. The first thing we do is we get those pieces of information from you, and we will scale it back. So when we put all that in, it comes up with hundreds and hundreds of plans. So that's when we get really deep in the weeds, as I'd like to say, because we'll pretty much ask you everything from A to Z. We're going to ask you who your primary care doctor is, who are you seeing outside of your primary care, all the ologists, as I like to say, oncologist, urologist, cardiologist, dermatologist. So anything outside of your primary care is considered a specialist. Not many people know that. So that's a different fee from your primary care to your specialist. So if you have all of those, we want to pick a plan that can kind of get you a price that you're comfortable with, because they're all different. You can pay anywhere from $50 for a specialist up to like $150. So we want to make sure that we're getting something that you're comfortable with. There's also deductibles. I mean, this is a whole thing. We might need to put this in another session too, but you have deductibles, you have your out-of-pocket max. So there's a lot that goes into it. So once we plug in those informations, your medications, that's a big, big deal. We need to make sure that we get all of your medications correct. So the best thing to do is to bring in your bottles, and that way we can read it from the label itself, and we can pretty much tell you what you're going to pay for that prescription before we even sign you up with a policy, because they fall in a different tier. And then you will not pay more than, because some pharmacies, if it says that your generic prescription's $25, some pharmacies might only charge you $8 or $10, but you will not pay more than the amount that's on there. And then we also have the GoodRx cards. Some people don't want to use those because it doesn't shave it off of their deductible or their out-of-pocket max. But honestly, if it costs $5 on a GoodRx card and it costs $25 on your policy, I don't think you're going to miss that too much. So I always encourage people to use that and save money how they can.
Yeah. So I know for myself, we have insurance, obviously.
I hope so.
through our office. And our copays are, I don't know, I think $10 or $15. And I have medications, but I use my GoodRx card that we have. We have those here in our office. And you can use those. In addition, it does not affect your insurance, good or bad. It doesn't go against, like you said, it doesn't come off of the amount of out-of-pocket max that you owe each year according to your plan, or the deductible that you have to meet. But if you're pretty healthy and you have a medication you have to get 12 times a year and it's $10 and as opposed to $3, you're going to save money. And so it just makes sense financially, to use. And I I do that
Right.
myself. So I like I like the fact that I know for myself when I go to my primary care physician, um, even they require that you bring your bottles with you.
Hmm.
I've gone before and I'm like, I've been coming here for years. You have my medications.
Right.
Why do I have to bring my bottles? It's because we're human and there are so many medications. People think, okay, I take Tylenol.
Hmm.
Okay, well, do you take
Tylenol 3.
Tylenol 3? Do
Yeah.
you take Tylenol cold and, do you take Tylenol
Right.
250
Hmm.
milligrams? Do you take Tylenol 500? Okay, well, I take Tylenol 250. Okay, well, is it a capsule? Is
Hmm.
it a tablet? Is it a
Right.
syrup? And so when the prices of
Right.
medications in our world, that's called the formulary.
Right.
So when prices, reimbursement prices to pharmaceutical companies is being designed by insurance carriers, they take every type of medication
Right.
in any way it's dispensed. So whether it's an injection, whether it's a tablet or sublingual, there's so many different types
Hmm.
out there.
Hmm.
And, it's not as simple as coming in and saying, I take metformin.
Right.
Okay, well,
There's
what's your milligram?
right. Right. Right.
And then you get so deep that it's, well, I take 10 milligrams or it's not, it's 10 mcgs.
Hmm.
And so even though it may be aggravating
Hmm.
to bring those medications in, primarily all primary care physicians now require that you bring those bottles in.
Right.
And so to justify
Hmm.
why we ask people to do that is because we're able to give you a more solid
Right.
a price,
Hmm.
right? And anticipation of your copay for each of your
Right.
medications when you do that.
Right.
And I like your ologist family. I've been in healthcare since I was 18 years old, and that was a long time ago. And I've never heard that, and I absolutely love. So if you have someone who sees you from the ologist family, that is a different copay
It
than
is. It
than your
is.
family doctor,
Right. Well, it's just, I guess it just resonates with people because your primary
Yeah,
care is just your doctor, and then all the rest of them are
the
they're the
ologist.
ologist. That's right. But
I
going back,
love it.
yeah, going back to the medications, there could be different prices. There could be, and I'm going to use Adderall just because that's an easy one. Adderall is usually. I have ADD, so I know all about it. But there's just a plain Adderall, and then there's an Adderall XR, which is extended release. They're two different prices.
Right,
So you can tell me I'm on Adderall. Well, great. Well, you
right,
might pay $50 for one and you might pay $100
right.
for the other. So it's very important. And that's another reason why we get so deep into it is when you start bringing your medications because the prescription plans are different on each policy.
That's right.
So what we do is we try to eliminate which one is a higher tier than the other one. And same thing with your doctors. We can go ahead and eliminate the plans out of the way that we don't even need that your doctor
Right,
that doctor's office doesn't accept. And that way we're not looking at 4 or 5 policies. Then we've kind of narrowed it down to 2.
right,
And if you don't know what you're looking at, you're going to look at it like it's a foreign language.
right.
So it kind of helps you as the consumer not be so taken back or frustrated with the process. And then what we do is we sit down and we go through your main concern. Your main concern may be urgent care because a lot of people have to wait 2 or 3 days when they're going to the doctor and they're like, well, I can go to urgent care quicker than I can get
Right,
into my doctor's office.
right,
So we start talking about what's important to you as the client, and that's a lot easier for me because I'm like, okay, well, it's right here, and it's $75 on this plan and it's $50 on this plan, and they're not
right.
even worried about their primary care. So we start eliminating like that. It's really easy, and
Yeah,
it just helps for the consumer to say this is what's important to me, and then what's important to you might not be important to me. So
right.
it's all individual. We mold it to each person that comes in.
Right. And I think if I remember correctly, we're able to filter
Hmm.
plans that are available by doctor, primary care. We can put in specialists or
Yep.
the ologist, as
Hmm.
you call them, medications,
Hmm.
and even hospitals.
Yes.
Um, Surprisingly, we've learned over the last years we've been here, not everybody wants to use a special hospital. They want to use another hospital. And
Hmm.
so when picking a plan, you're not just given a one size fits all.
Right.
There is no such thing in healthcare or in healthcare health insurance. There is not a one size fits all. It is we can narrow that and tailor it to where it's customized. And I
Right.
think that's the key word that maybe we focus on is that the plan for you is customized
Right. It's
to
molded to
you
you.
and your needs.
Mhm.
And so that's very exciting to know. I know, every day the world changes. We have Teladoc. We have, as they call them, virtual visits. Things like that have started to be included in these plans. A lot of people, back in the day, I know because I used to work at a hospital, people would use the ER as a dentist or
Right.
as their primary care. I mean, seriously,
Right.
I can remember seeing the same people. They would come in for a headache. Well, why are you in the ER, the most expensive? Because they had no insurance and the ER would see them
Right. They won't turn them away.
and they won't turn them away. And so that is no longer the case either. Those things are changing. And then now we have virtual visits where you can just pick up your phone or FaceTime or, you put your name in the line, you call the number on the back of your
yeah.
card. They'll say in 10 minutes, someone's going to call you, answer it, you tell them your symptoms. They even have the capability of doing a video phone call where you open your mouth and say,
Yeah.
yeah. And they can say, oh, it looks like you have tonsillitis.
I've done that.
Yeah. It blows my mind from where, in my generation, from where healthcare has come from.
Right.
The things that are out there now. I mean, I remember, when it was announced that they had robotic surgeries. I mean, oh my gosh, we're so past that now.
Yeah.
So again, please know, right, that if you call our office, we can't give you, it's not the same for everybody.
Right,
It's not
right.
$10 for everybody.
Right.
It is custom, and that should make you feel more comfortable because we're here to help you customize your health insurance plan
Right.
to fit you
Right.
and the people in your home and in your family that need coverage. And we won't stop until we find
Right.
the best plan for you.
Right.
And again, Robin, I'm so thankful for you. I appreciate your time. I appreciate your expertise. I appreciate the fact that you continue to, lifelong learning. You're
Yeah.
always learning new things and sharing them with our team and with the community. So thank you so much. And if you guys haven't had a chance to come into the office, if you're in need of health insurance and you're nervous or you're scared because you don't know, what to expect, the fear of the unknown, I think, is what most of us are challenged with.
Right.
Don't be afraid. What's the worst thing that can happen?
Yeah.
You can say no.
Yeah.
We're not going to make you, it's a free quote.
Yeah.
We don't charge you to come in. We don't charge you to call. Come in. Let us help you. Let us walk you through this.
Yeah.
Even if the time isn't right now for you to get a health plan, we have virtual plans we can offer. We haven't even talked about that.
Right.
And they're extremely
Inexpensive. Yeah.
every month. So please do not go another day without having some sort of security in case you get sick or you have a need for medical attention.
And I will say too, and you can vouch for us, when you come into our office and you become one of our clients, you really become our family.
Absolutely.
We have people that'll come in and sit for hours, and most of the time it's not talking about insurance. We're just talking about their grandchildren and things in life. So you do you come in as a client and you leave as family. So we love all of our customers.
Yes,
so.
absolutely. We absolutely do. Thank you for joining us today on Bridging the Gap. We're going to continue these podcast sessions. Please send us some comments. Go to our website, submit some reviews. Go to Google, leave us a review. If there's something that you would like to hear us discuss on Bridging the Gap, if you think that there's a gap between what we know and what you would like to know, please send us an email or call our office. We'll be more than happy to research the information and provide that to you in future podcasts. Again, again, we thank you for joining us. We thank you for your business, and join us right here next time on Bridging the Gap.